Hello, welcome. This is Here's to Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center here in Rocky Mount. And tonight we're going to talk a little bit about the heart. Different heart problems that you might not be really aware of. We all know, high cholesterol, high blood pressure can cause heart problems. And we know that you have to take care of yourself, you have to eat right, you have to exercise for you to have a strong heart. Our heart is a muscle, so it needs to be exercised just like our legs and arms do. And the way we exercise that heart is to get our heart rate up by a cardiovascular exercise of some sort, whether that's running, walking fast, getting on a treadmill, doing an elliptical, anything like that that will increase your heart rate to go up. So I've kind of been in the heart mood, that's not the right word, I've been learning about the heart more in the last few weeks. I belong to a professional women's networking group, and once a year they raise funds for the American Heart Association. Now we had Tanya Grimsley with us a few weeks ago, and she talked about the heart. She's from the American Heart Association. And so Tanya and I are working together in this group to find a survivor or two that can tell us what it was like to have a heart attack or have a stroke, and what you had to go through to get back on track, and what modern medicine has done for them to get them back on in their health. So if any of you out there have had a heart attack and you watch me, or even if you don't really watch me, if you've had a heart attack or a stroke and you would like, you can either come and speak to the group in person, or you can come and I'll get it taped and we'll show it on the tape at our to-do. And our to-do is hearts, high tea, and hats, I think is what it's called. And it's basically we're having a high tea, which the English, we're mimicking the English, and they're having their cucumber sandwiches and all that kind of stuff. So with nice hot tea and lovely goodies to eat. And so I'm really excited about it. I think it's going to be fun. So, and the other thing is, if you all are interested, I'll be buying a table. I would love for you to come and join me and sit with me at my table. The tickets are $50, and I know that sounds a little steep. 25 of it goes towards the goodies that we will partake of, and then the other 25 is the donation to the American Heart Association. So it's for a good cause, and I would love for you to come and wear a pretty hat if you've got one, and sit with me, and we will enjoy tea in the afternoon. It's the 29th of April from 2 to 4 o'clock, and I would just love to have some of my viewers there. I think it would be really fun to get to know you and meet you and those kind of things. So anyway, I've been thinking a lot about heart, and then I saw a patient today who has a condition called cardiomyopathy. And I thought, I don't know if I've ever even talked about that. All these years that I've been on this TV show talking about medical things, I don't think I've ever talked about some of these things I'm going to address tonight. So these fortunately are not real common. We don't want them to be common because they're debilitating diseases. You don't have a lot of energy, you don't have a lot of breath, you get short of breath real easy, things like that. So cardiomyopathy, that's a big fancy word for your heart is bigger than it should be. It's a disease of the heart muscle that makes it harder for your heart to pump blood to the rest of your body. Cardiomyopathy can lead to congestive heart failure, which we will talk about in a minute. The main types of cardiomyopathy include dilated, that means big. Hypertrophic means, I don't know what it means. And restrictive cardiomyopathy. Treatment, which might include medications, surgically implanted devices, and we're going to talk about those in a few minutes too. heart surgery, or in very severe cases, a heart transplant. It depends upon what kind of cardiomyopathy you have and how serious it is. So there's probably no signs or symptoms in the early stages of cardiomyopathy, but as the condition advances, the symptoms start appearing. And usually it's breathlessness with activity or even at rest, swelling of the legs, ankles, and feet, bloating of the abdomen due to fluid buildup, cough while lying down, difficulty lying flat to sleep, fatigue, heartbeats that feel rapid pounding or fluttering, chest discomfort or pressure, dizziness, lightheaded, and fainting. Signs and symptoms tend to get worse unless they're treated. And so if you start having any of those symptoms, you need to talk to your doctor. Some people, the condition worsens quickly, and some it takes a long time. It just might not worsen for a long time. So when you see the doctor is when you have one of those signs and symptoms that I just mentioned. And so what are some of the causes of cardiomyopathy or enlarged heart? Well, it can be passed down through your family, it can be inherited. If you have that condition, then your doctor might recommend that your other family members get treated and looked at as well. Other causes as a result of another condition, such as long-term high blood pressure. You know, that's why we want you to get your blood pressure controlled. That's why we want you to be on a blood pressure medicine if you need to. I know people don't want to take medicine. I hear it every day. I get it. I don't like taking medicine myself. But I don't want you to be sick either. Heart tissue damage from a heart attack, long, rapid heart rates, heart valve problems. You know, we can have stenosis of the valves. That's a hardening of the valves in your heart, and they don't work real well. COVID-19 infections, you know, you hear a lot about it going into your lungs, but it can cause a lot of heart problems too. Certain infections, especially those that cause inflammation around the heart, and we're going to talk about that in a little bit as well, if I get around to all of it. Metabolic disorders such as obesity, thyroid disease, or diabetes. Again, that's why we want you to be the best weight you can be. That's why we want you to eat as healthy as you can and exercise as much as you can to get a good weight. And control your diabetes and control your thyroid disease. Lack of essential vitamins or minerals in your diet, such as vitamin B1, pregnancy complications, iron buildup in your heart, that's called something called hemochromatosis, tiny lumps of inflammatory cells or granulomas in any part of your body, including your heart and your lungs. A buildup of abnormal proteins in the organs, connective tissue disorders, drinking too much alcohol over years, use of cocaine, amphetamines or anabolic steroids, and use of some chemotherapy drugs and radiation to treat cancer. So those are some of the causes. There's quite a few of them. A lot of them you can control by, like I said, eating better, keeping your weight down, controlling your blood pressure, making sure your lipids are under control. Nobody wants to take a statin. I get that too. But we don't want these other things to happen to you as well. So sometimes you just got to figure out the benefit versus the risk. You know, which is more is better for you, the benefit of not having cardiomyopathy or some of these problems, or the benefit of not having the side effects from the statin or the drug, the blood pressure. So It's, it's hard to decide, and it's hard for people, especially if you don't feel bad. You're like, well, what do I need that for? All right, so there's a couple different kinds of cardiomyopathy. One is dilated cardiomyopathy. And in this type of cardiomyopathy, the pumping ability of your heart's main pumping chamber, the left ventricle, becomes enlarged or dilated and can't effectively pump out the blood. Although this type can affect people of all ages, it occurs most often in middle-aged people and is more likely to affect men. The most common cause of coronary artery disease or heart attack. However, it can also be caused by genetic defects. And then there's hypertrophic cardiomyopathy, and this involves abnormal thickening of your heart muscle, which makes it harder for the heart to work. It mostly affects the muscle of your heart's main pumping chamber, again, the left ventricle. Hypertrophic cardiomyopathy can develop at any age, but the condition tends to be more severe if it occurs during childhood. Most people with this type of cardiomyopathy have a family history of the disease. Some genetic mutations have been linked to hypertrophic cardiomyopathy. And then there's restrictive cardiomyopathy. In this type, the heart muscle becomes stiff and less flexible, so it can't expand and fill with blood between heartbeats. This least common type of cardiomyopathy can occur at any age, but it most often affects older people. And sometimes restrictive cardiomyopathy can occur for no known reason. That's called idiopathic. And, or it can be caused by disease somewhere else in the body that affects the heart. And then there's Arrythmogenic right ventricular dysplasia. Now, if you don't think that isn't a mouthful. This is a rare type of cardiomyopathy. The muscle in the lower right chamber of the right ventricle is replaced by scar tissue, which can lead to heart rhythm problems. It's often caused by genetic mutations. And then there's an unclassified cardiomyopathy, and that's when it isn't these other things and they don't know what else to call it. So we've already talked about the risk factors. If you have a family history of cardiomyopathy, heart failure or sudden cardiac arrest, those are problems. Long-term high blood pressure, conditions that affect the heart, including a past heart attack, coronary artery disease, or an infection in the heart called ischemic cardiomyopathy. Ischemic means you don't get enough blood. That's what happens in your heart. The clot blocks off the artery that feeds the heart. It becomes ischemic. It doesn't get the blood flow it needs, and then the tissue dies because it doesn't get fed the way it's supposed to. Obesity, because that makes our heart work faster, work harder. You know, you see people that are heavy set and they walk across the parking lot and they're sweating and they're huffing and they're puffing. Well, just think what their little heart's trying to do. Illicit drug use, long-term alcohol misuse, and treatment, again, with certain chemotherapy drugs. The diseases that can raise your risk of cardiomyopathy, and just about everybody's got some of this, I think. Diabetes, thyroid disease, excess iron in the body, amyloidosis, sarcoidosis, connective tissue disorders. And then there's a lot of complications that can happen because of that as well. Heart failure, your heart can't pump enough blood to meet your body's needs. And if you don't treat that heart failure, it's life-threatening. Blood clots, because your heart can't pump effectively, blood clots might form in your heart. If clots enter your bloodstream, they can block the blood flow to other organs, including your heart or brain. Just what I talked about for the heart attack. It's the same thing in your brain. If one of the arteries that feeds your brain is blocked off because of a a piece of, well, what's the word I'm looking for, y'all? Clots. What a simple word, and I couldn't think of it. It can, if there's a clot in one of those arteries, then you can have a stroke. And a stroke is, affects any part of the brain. There's different kinds of strokes because there's different parts of the brain affect our bodies differently. But so, we don't want that. We don't want any blood clots in our blood at all. And then, of course, cardiac arrest or sudden death, that can cause cardiomyopathy, or cardiomyopathy can trigger abnormal heart rhythms that can cause fainting or even death, depending upon what it is. So, what the prevention is. We've already talked about all of that. And that, my dear friends, is cardiomyopathy. So now we're going to talk about congestive heart failure. We won't get too far into this. It's cold in this studio, y'all. Heart failure, which is also known as congestive heart failure, occurs when the heart muscle doesn't pump as well as it's supposed to. When this happens, blood backs up and fluid can build up in our lungs, causing shortness of breath. Certain lung conditions, such as narrowed arteries in the heart, coronary artery disease, or high blood pressure, gradually leave the heart too weak or stiff to fill and pump blood properly. Proper treatment can improve the signs and symptoms of heart failure and may help some people live longer. Lifestyle changes such as losing weight, exercising, reducing salt in your diet, and managing stress can greatly improve the quality of your life. We want a quality of life. We don't want a quantity of life. We've talked about that in many shows prior. So we want to have a quality of life. But heart failure can be life-threatening. People with heart failure may have severe symptoms. Some may need a heart transplant or a ventricular assist device. And so one way to prevent all that is just like all the other causes that we go through: eating well, exercising, control your high blood pressure, control your diabetes, try to lose weight and not be obese. Okay, I'm going to stop right here. It's time for our first break. And when we come back, we'll talk more about heart failure. I'm live tonight. It's March 9th, 2022. And my phone number is 407-1111. Don't go away. We'll be right back with more of Here's to Your Good Health.
At Down East Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
Are you suffering from Medicare and Medicare supplement confusion? As you prepare to turn 65, I'm sure you're already bombarded by Medicare supplement mailings and phone calls. Don't be frustrated. Don't stay confused. Call Gus Tellis. He can get you into the right plan that will work best for your needs. So don't wait. Call today and get the peace of mind that comes from knowing you're covered.
Call me today, 252-937-6913.
Today, some of the world's most advanced orthopedic techniques and technology are available right here in the Twin Counties. At UNC Orthopedics at Nash, our team of specialists offers a full range of orthopedic treatment, including spine services, hip, knee, and shoulder repair, as well as joint replacements and rehabilitation. So don't just live with the pain and immobility. The best care anywhere is close by. UNC Orthopedics at Nash.
Hi, I'm Richard Goss, pharmacist and owner of Allman's Drugstore here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Allman's Drugstore has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Allman's Drugstore's locations and also at our medical supply store.
Come in and see us at Allman's Medical Supply. We're an extension of Allman's Drugstores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports, compression hose, to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Allman's Drugstore staff will work hard to meet your pharmacy needs. At Allman's, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Allman's Drugs today.
443-3138 or 446-0014.
Well, howdy, welcome back. This is Here's to Your Good Health. This is a community service program sponsored by WHIG-TV. This program is for you, by you, and about you. I will talk about anything you want me to talk about. You just have to let me know. I'm live tonight. Call me at 407-1111. So we talked about cardiomyopathy, which is an enlargement of the heart, and talked about the things that can happen to our body because of having uncontrolled blood pressure, for instance, that can cause this problem. Then we started talking about congestive heart failure or heart failure. I think congestive heart failure is maybe an older term. I don't know. I'm not a cardiac nurse, so I know just a little bit, just enough to be dangerous, I guess. So anyway, congestive heart failure is when the heart muscle doesn't pump the way it's supposed to, and then blood backs up and fluid can build up in our lungs, causing shortness of breath. So what are the symptoms of congestive heart failure? Well, we have shortness of breath with activity or laying down, fatigue and weakness, swelling in the legs, ankles, and feet, rapid or irregular heartbeat, reduced ability to exercise, persistent cough or wheezing with white or pink tinged mucus, swelling of the belly area, your abdomen, very rapid weight gain from fluid buildup. I mean, you can gain 5 pounds in a day. Nausea and lack of appetite, difficulty concentrating, or decreased alertness. If I can make my fingers work. All right. So when are you supposed to go see a doctor? Well, if you're experiencing some of the signs of heart failure, and I just talked about, you might need to call 911, especially if you have chest pain, fainting or severe weakness, rapid or irregular heartbeat associated with shortness of breath, chest pain, or fainting. Sudden severe shortness of breath and coughing up pink or white foamy mucus. Although these signs and symptoms may be due to our heart failure, there are other possibilities, including life-threatening heart and lung diseases. Don't try to diagnose yourself. You're going to have a chest x-ray to determine if there's fluid in those lungs. And emergency room doctors will try to stabilize your condition and determine if your symptoms are due to heart failure or something else. If you have a new diagnosis of heart failure, and if any of the symptoms become worse, you may develop a new sign or symptom. It may mean that your existing heart failure is getting worse or it is not responding to the treatment that you're on. This may also be the case if you gain 5 pounds or 2.3 kilograms or more within a few days. You need to contact your doctor promptly. We do have a congestive heart failure clinic here in town now, which is run by, I believe, 2 nurse practitioners, 1 nurse practitioner for sure. And so they can, keep track of you if you've got if you've got congestive heart failure and you've got this rapid weight gain. You can go over there, you can call them, and they can give you something called Lasix. It's called a diuretic. It pulls the fluid out of your body, and they can give you that, and you can get back on track and not have to go to the hospital. So we try to keep people out of the hospital. Sick people are in the hospital. There's lots of bugs, lots of germs. We don't want to be in a hospital if we don't have to be. So heart failure often develops after other conditions have weakened our heart, or if our heart becomes too stiff. In heart failure, the main pumping chambers of the heart, the ventricles, may become stiff and not fill properly in between beats. In some people, the heart muscles may become damaged and weakened. The ventricles may stretch to the point the heart can't pump enough blood through the body. Over time, the heart can no longer keep up with the typical demands on it to pump blood for the rest of the body. Your doctor can determine how well your heart is pumping by measuring how much blood is pumped out with each beat. That's called an ejection fraction. Ejection fraction is used to help classify heart failure and guide treatment. So you might have an echocardiogram or some type of heart testing, and they will tell you your ejection fraction is 40% or whatever it is. In a healthy heart, the ejection fraction is 50% or higher, meaning that half of the blood that fills your ventricle is pumped out with every beat. And that's what we want. But, of course, there's always a but, right? Heart failure can happen even with a normal ejection fraction. This happens if the heart muscle becomes stiff from conditions such as high blood pressure. Heart failure can involve the left side or the left ventricle, the right side, the right ventricle, or both sides of your heart. Generally, heart failure begins with the left side, specifically the left ventricle, and that is your heart's main pumping chamber. So some of the types of heart failure, there's left-sided heart failure, and fluid may back up into the lungs, causing shortness of breath. Right-sided heart failure, fluid may back up into the abdomen, legs, and feet, causing swelling. Systolic heart failure, also called heart failure with reduced ejection fraction, that's when the left ventricle can't contract vigorously, indicating a pumping problem. Heart failure with preserved ejection fraction, the left ventricle cannot relax or fill fully, indicating a filling problem. So any of these problems can weaken your heart and cause heart failure. Coronary artery disease, heart attack. Coronary artery disease is the most common form of heart disease and the most common form of heart failure. This disease results from the buildup of fatty deposits in the arteries, which reduces blood flow and can lead to a heart attack. A heart attack occurs suddenly when coronary artery becomes completely blocked. Damage to the heart muscle from a heart attack may mean that your heart can no longer pump as well as it should. High blood pressure. If your blood pressure is high, your heart has to work harder than it should to circulate blood through your body. Over time, this extra exertion can cause the heart to weaken and not be able to properly pump blood. You can have faulty heart valves, and the valves of the heart keep blood flowing in the proper direction. A damaged heart due to a heart defect, coronary artery disease, or a heart infection forces the heart to work harder, which can weaken it over time. Damage to your heart muscle can have many causes, including certain diseases, infection, heavy alcohol use, toxic effective drugs such as cocaine or drugs used for chemotherapy, and genetics can also play a role. Inflammation of the heart, which is called myocarditis, and we're going to talk about that in a minute, is most commonly caused by a virus, and including the COVID-19 virus, and can lead to left-sided heart failure. But believe me, there's been plenty of myocarditis well before COVID-19 came along. It's just one more virus that can attack us. You can have a heart problem you're born with. That's called a congenital heart defect. And if your heart and its chambers or valves aren't formed correctly, the healthy parts of your heart have to work harder to pump blood, and that can lead to heart failure. Abnormal heart rhythms, called arrhythmias. Abnormal heart rhythms cause your heart to beat too fast, including creating extra heart work on your heart. A slow heartbeat may cause heart failure. And then if you've got long-term diseases such as HIV, diabetes, overactive or underactive thyroid, a buildup of iron or protein, that may also contribute to chronic heart failure. And causes of a sudden acute heart failure can also include allergic reactions, any illness that affects the whole body, blood clots in the lungs, those are called pulmonary embolus or emboli. Embolus is one, emboli is more than one. Severe infections, use of certain medications and viruses that attack the heart muscle. So your risk factors are coronary artery disease, and you all probably already know if you have that, heart attack, heart valve disease, high blood pressure, irregular heartbeats, congenital heart disease, diabetes, some diabetes medicines. Both of these are very rarely used anymore. One is called Avandia and the other one's called Actos. And they've been found to increase the risk of heart failure in some people. But if you're on these medicines, don't stop taking them. You need to talk to your doctor. And then there's other medications, including non-steroidal anti-inflammatory drugs. That's Advil, Aleve, ibuprofen, Motrin. I've actually met a patient that had a heart attack caused by one of those non-steroidal anti-inflammatory medicines. Then there's certain anesthesia medicines and certain medications used to treat high blood pressure, cancer, or blood conditions, irregular or abnormal heartbeats, nervous system diseases, mental health conditions. You know, every medicine we take has a side effect, and that's why it's so important that you talk to your doctor. And if there's a lot of side effects that really scare you, talk to your doctor, because there are plenty of different medicines out there. They're all going to have some kind of side effect, but they might not have one that affects you as much as something else. So don't drink a lot of alcohol. Now, if you have sleep apnea, you need to have it treated. Untreated sleep apnea is definitely hard on your heart. You have low blood oxygen in your blood when you're snoring, or when you're not able to breathe properly when you're sleeping. And that can cause irregular heartbeats. That can weaken your heart. You can also have something called pulmonary hypertension, which is high blood pressure in your lungs. And we talked about, tobacco use is just no good for anything. So some of the complications, and these are what scare me as much as the heart failure does, is the complications. Kidney damage or failure. Heart failure can reduce the flow of blood to your kidneys, which will eventually cause kidney failure. Every organ in our body has to be fed by our blood. That's how God made us. That's what we need to keep healthy. And if you don't have good blood flow to your kidneys, then you're going to have damaged kidneys and might have to go on to dialysis. Heart valve problems. Valves of your heart which keep flowing blood in the right direction may not work properly. And those problems can be fixed pretty easily. Heart rhythm problems, if you've got something like atrial fibrillation or tachycardia or bradycardia, different heart conditions, those can cause heart failure. Liver damage. Heart failure causes fluid buildup that puts too much pressure on the liver. The fluid backup can lead to scarring, which causes your liver not to work well. So, the prevention is the same. I feel like I'm a broken record. I feel like, I just say it over and over and over. Don't smoke. Keep your blood pressure and diabetes treated. Stay physically active. Eat healthy foods. Maintain a healthy weight. Reduce and manage your stress. All right, it's time for our second break. I'm not going to get through all this, y'all. I just know that. But anyway, it's okay. So we'll be right back after more of from these. Let me start over. We'll be right back after we have these commercials and words from our sponsors, and then I'll be back with more of Here's to Good Health. Hang on.
At Down East Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
Today, some of the world's most advanced orthopedic techniques and technology are available right here in the Twin Counties at UNC Orthopedics at Nash. Our team of specialists offers a full range of orthopedic treatment, including spine services, hip, knee, and shoulder repair, as well as joint replacements and rehabilitation. So don't just live with the pain and immobility. The best care anywhere is close by. UNC Orthopedics at Nash.
Are you suffering from Medicare and Medicare supplement confusion? As you prepare to turn 65, I'm sure you're already bombarded by Medicare supplement mailings and phone calls. Don't be frustrated. Don't stay confused. Call Gus Tellis. He can get you into the right plan that will work best for your needs. So don't wait. Call today and get the peace of mind that comes from knowing you're covered.
Call me today, 252-937-6913.
Hi, I'm Richard Goss, pharmacist and owner of Allman's Drugstore here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Allman's Drugstore has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Allman's Drugstore locations and also at our medical supply store.
Come in and see us at Allman's Medical Supply. We're an extension of Allman's Drugstore, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. and you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Allman's Drugstore staff will work hard to meet your pharmacy needs. At Allman's, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Allman's Drugs today.
443-3138 or 446-0014.
Hey, welcome. This is Here's Your Good Health. We've been talking about conditions of the heart. We talked about cardiomyopathy. We talked about congestive heart failure. Lack of sleep probably is one too. I know, I'm kidding. And then now we're going to talk about pericarditis. Pericarditis is the swelling and irritation of the thin sac-like tissue surrounding the heart, the pericardium. Pericarditis often causes sharp chest pain. The chest pain occurs when the irritated layer of the pericardium rub against each other. Pericarditis is normally mild and it goes away without any treatment. Treatment for the more severe cases may include medications and rarely surgery. Early diagnosis and treatment may help reduce the risk of long-term complications from pericarditis. Chest pain is the most common symptom of pericarditis. It usually feels sharp or stabbing. However, some people do have a dull ache or pressure-like chest pain. Pericarditis usually occurs behind the breastbone or on the left side of the chest. The pain may spread to the left shoulder and neck, get worse with coughing, laying down, or taking a deep breath, get better when sitting up or leaning forward. Other signs and symptoms of pericarditis might include cough, fatigue or general weakness, leg swelling, low-grade fever, pounding or racing heartbeat, those are heart palpitations, shortness of breath when laying down, swelling of the belly. The specific symptoms depend on the kind of pericarditis. Pericarditis is grouped into categories according to the pattern of symptoms and how long the symptoms last. So acute pericarditis means that it begins suddenly, but it doesn't last for longer than 3 weeks. Future episodes can occur. It may be difficult to tell the difference between acute pericarditis and the pain from a heart attack. So just go to the ER and let the doctors figure it out. Recurrent pericarditis, that happens, it occurs about 4 to 6 weeks after the initial acute pericarditis with no symptoms in between. Incessant pericarditis lasts about 4 to 6 weeks but less than 3 months. The symptoms are continuous. Then you have chronic constrictive pericarditis, which develops slowly and lasts longer than 3 months. And I've had patients that have had that, and we've had to do multiple EKGs, and one of the main treatments is non-steroidal anti-inflammatory medicine, and that's something. So the causes of pericarditis are usually pretty hard to find, and you might not cause a reason for it or a cause for it, and that again is called idiopathic. So you can get pericarditis from immune system response after a damaged heart due to a heart attack or heart surgery. An infection, it's a virus such as COVID-19. Inflammatory disorders including lupus and rheumatoid arthritis, injury to the heart or chest, and other chronic conditions including kidney failure and cancer. So the complications are fluid buildup around the heart. That's called a pericardial effusion. Fluid buildup can lead to further heart complications. Thickening and scarring of the heart lining, constrictive pericarditis. Some people with long-term pericarditis develop permanent thickening and scarring of the pericardium. The changes prevent the heart from filling and emptying properly. This unusual complication leads to severe swelling of the legs and abdomen due to shortness of the breath. Pressure on the heart due to fluid buildup, which is called cardiac tamponade. This life-threatening condition prevents the heart from filling properly. Less blood leaves the heart, causing a dramatic drop in blood pressure. Cardiac tamponade requires emergency treatment. So prevention, stay around people who have flus or viruses. Well, hello, we need to do that anyway. And if you're sick with a viral infection, try not to expose other people. Follow good hand washing and good hygiene. Regular hand washing prevents illnesses and viruses from spreading. Excuse me. And get your recommended vaccines. You know, we've got COVID vaccine, rubella, influenza. Those are diseases that can cause myocarditis, so you should have all of those immunizations. And so, you know, that can also happen in males 12 to 17, and that's pretty rare. So that is pericarditis. And then I was going to talk about a pacemaker and a defibrillator. So before I do that, I just wanted to go over again about this hearts, hats, and high tea, which will be April 29th. It's a Friday afternoon from 2 to 4. It's going to be at the new Smith's Pavilion, which is next door to Smith's Red and White in Dorchester. And it's a brand new facility. It's beautiful. I was in there the other day, and you can have any kind of party happening, wedding, anniversary, big birthday party there. They've got a lot of things going on. They've got, they're really going to start catering to weddings out there, so that's good. But we're going to be out there, and so I'm really excited about that. We're one of their first venues, and so they've got a chef right there on staff, so we're going to have good food. Again, I'm going to be buying a table which seats 8. I would love for you to come and join with me, sit with me, tell me, you know, that you watched this show and that's how you got those tickets. The tickets are $50. 25 of that is for the food and the drink and the tea and all that. And then 25 of it goes to the American Heart Association. So mark your calendars, April 29th from 2 to 4, and wear a pretty hat. All right, a pacemaker. It's a small device that's planted in your chest to control the heartbeat. A lot of times you have a pacemaker because your heart has been beating too slowly. It might be even complete heart block, which means that you might have one beat and then you don't have any for a while, and the heart is just not beating. And so it's a surgical procedure put in by surgeons, and it develops electrical charges to your heart. So when your heart beats too slow, or if it stops beating, these electrical impulses, you know, shock that heart into working again. So there's a single chamber which carries electrical impulses to the right ventricle. There's a dual chamber pacemaker that carries electrical impulses to the right ventricle and right atrium, which is the top of your heart. The heart has an atrium and a ventricle on the left side and the right side. And then ventricular pacemaker, and that's also called cardiac resynchronization therapy. That's for people who have heart failure and heartbeat problems. This pacemaker stimulates both of the lower heart chambers to make the heart beat more efficiently. So, a pacemaker is implanted to control the heart rate, you control your heartbeat. And it's usually put in for a slow heartbeat, which can be caused by a heart attack, or various other reasons. You might be on some medicine that causes a slow heart attack, a slow heartbeat. So your heart beats, it's a muscle, and it has it's a fist-sized pump, so your heart's about the size of your fist. So my heart, pretty good size, I guess. And it has 4 chambers, 2 upper and 2 lower. The upper ones are called atria. The lower ones are called ventricles. And they work with your heart's electrical system, because our heart is an electrical system. It sends electrical impulses throughout our heart to make it work right. And so that keeps your electrical system in your heart beating the way it's supposed to. It's usually somewhere between 60 and 100 for most patients. So your heart's electrical system controls your heartbeat, beginning in a group of cells at the top of the heart called the sinus node, and spreading to the bottom, causing it to contract and pump. Aging heart muscle from a heart attack, certain medications, certain genetic conditions can cause an irregular heart rhythm. So the pacemaker only works when it's needed. So if your heart is beating at 70 beats a minute, you're fine. They'll set the pacemaker to send an electrical impulse, and usually it's set about 60 beats. So if you drop under 60 beats, then that pacemaker is going to send you an electrical shock, or electrical beat, I guess is a better word than shock. So it's a small metal container. Now they have it all so they can check your pacemaker from a doctor's office, because it's got some computer chip or something, I don't know. And they can just check that to make sure that it's still working right. And I just wanted, with my last couple of minutes, I'm not going to go into the rest of the pacemaker or the implantable, the cardio defibrillator, which is another part of it's something that's planted in your chest, in that if you have a heart rhythm that goes abnormal, like ventricular tachycardia, for instance. Tachycardia means too fast, ventricular means from the ventricle. Then you'll have a defibrillator, and then that will send a shock to your heart to make it jump back into a normal rhythm. It's kind of the same thing as the shock when you see on TV, or you see these AEDs hanging, and if somebody has a heart attack or something, you can place these electrodes on them, and it will read the heart and tell you what to do. Well, the implantable defibrillator does the same thing. So I just wanted to, this is pretty interesting to me. The heart, it's an electrical system, or it's a plumbing system. So the electrical system is what we've been talking about, that it has electrical impulses that go through the heart and make it beat properly. So we can have an abnormal electrical system, and then we have to go and see a certain kind of cardiologist to have your electrical problem taken care of. Then it's also a plumbing system, and that is like a cardiac cath, where things have closed down for one reason or another. They got blocked by a clot, and so you might put a stent in that artery to open it up so the blood flows through it again. and that's your plumbing system. I always thought that was kind of cool because, you know, we have electrical systems at our house and plumbing systems at our house, and we've got electrical and plumbing system in this house too. So that's it for tonight. I'm so glad you joined me, and I will see you next week with more of Here's to Your Good Health. Have a great night. Good night.